Hi everyone. Usually the videos in this channel are meant for MBBS graduates, postgraduates in ENT, PG students preparing for entrance. But today there is a difference. The talk that I am giving today is meant for all general practitioners and even for all common people who are having to take a lot of medicines, and sometimes they wonder why some medicines when they take are affecting their voice. Yes, today's talk is on the topic medications affecting voice. How is voice produced? You know that it's the vocal cords which vibrate that produces the voice that gets amplified by the resonance, and then finally after articulation you have the speech coming out, right? Now the vocal cords that vibrate, for it to be in the optimum functional state, it has to be hydrated well. It should be in a moistened state. And how is that ensured? For that you have to drink adequate amount of water. Up to 2 to 3 liter per day is what is optimal. The dictum is that whenever you pee, it should be pale. Only then you can ensure that there is enough water in your body, and only if there is enough water you can ensure that the vocal cords are in a moistened condition. And so whenever you are dehydrated in any way, it can result in a bad voice. There are certain medications which can cause drying of your vocal cords. What are they? First of all, one of the most common medication that is being taken, what is that? Antihistamines and decongestants. They are being taken whenever you are having a common cold, right? It is prescribed left and right. So remember, if you are a singer or a teacher, when you are having a common cold, when you are taking some antihistamines, there is a high chance that can result in drying of your vocal cord, and that can result in a bad voice. And what are these decongestants? Decongestants are the phenylephrine, the pseudoephedrine. The systemic decongestants are sometimes given as combination drugs for common cold along with antihistamines, as in Vicodin, Sinarest, etc. So all these can result in drying of vocal cords and affect your voice. Now there are certain diuretics which are given as part of antihypertensives as well as for congestive cardiac failure. And when you are giving diuretics, what is happening? You are losing a lot of urine, along with that you are losing water out of your body, right? And because of that it can result in drying of your vocal cord and result in a bad voice. And of course there are some antipsychotics and antidepressants including SSRIs that can result in drying of vocal cords. And anticholinergics and antisecretory agents are part of general anesthetic agents, and that also can result in drying of vocal cords. Apart from drying of vocal cords, what else can result in a bad voice? When the vocal cords venous drainage is not happening properly, that results in edema of the vocal cords. What can happen? You know that the vocal cords can get swollen up like this. When the vocal cords get swollen up, what happens? It can result in increase in the thickness of the vocal cords and mass of the vocal cord, and that can result in a low pitched voice. Okay, so that's another reason why in females during the last 6 to 7 days before menstruation, that is the premenstrual days, they will be having a thicker voice, and in the initial days of menstruation also they will be having such a voice, because the estrogen support is gone and only progesterone is there, and because of that what happens is that there will be edema in the vocal cords, and during this period it is advised that females do not shout or strain their voice. So there are certain medications that can result in a similar effect, that is the drugs which contain estrogen, progesterone and testosterone combination, such as the OCPs, the danazol. All these can result in a voice change. Now another drug, phosphodiesterase 5 inhibitors also can result in a similar effect. It is commonly called as Viagra. Okay. Now, what about inhaled steroids? What effect does inhaled steroids have on your voice? When you are having a lot of inhaled steroids to be taken, as in bronchial asthma, there are two things it can result in. One, it can cause vocal cord atrophy. As you can see here, the thyroid node muscle can get atrophied, and because of that the patient can have a breathy voice due to the phonatory gap. And in the other picture you can see how a fungal laryngitis has occurred in a patient who was on inhaled steroids. So that is the other effect that can happen in a patient who is on inhaled steroid for a long period of time. So if he is having voice change, this is one thing that has to be suspected. Now, what else can cause problems? When a patient is on antiplatelet or an anticoagulant or thrombolytic, all these are being given when there is a coronary artery disease or a stroke, right? In such patients, what can happen? There is high chance of vocal cord hemorrhage to occur. In a patient having a vocal cord hemorrhage, if he suddenly shouts or strains his vocal cord, what happens? The hemorrhage can get organized and form a hemorrhagic polyp, as you can see here. So this is a vocal cord hemorrhagic polyp that you see here. Now there is something called as AC inhibitor, which is commonly available in the form of enalapril, ramipril. There is a common side effect associated with AC inhibitors. What is it? It can result in cough. Why the cough occurs? Because of increase in the level of bradykinin. And when the cough is too much, what can happen? It can result in idiopathic ulcerative laryngitis or an adenoid granuloma if the cough is not subsiding. So in a patient with chronic cough, when investigated and not found to have any cause, only if you are taking a detailed drug history and finding something like this as the cause, you will be able to treat the patient properly. So that's in a nutshell about the various medications that can affect your voice. Thank you.